My name is Rauda Tellawi, and I'm an obstetrician and gynecologist for Johns Hopkins Community Physicians in Howard County. If somebody is below the age of 35 and they're trying for pregnancy, it actually takes about a year for a healthy couple of having timed intercourse for that whole year to conceive. So if a patient has tried for only 3 months, we usually tell them, please try a little bit longer, because this actually can be totally normal. If somebody is above the age of 35, that period becomes about 6 months of trying that we allow them to do, and then at age 40, it's only about 3 months. For patients who have tried and struggled and it hasn't worked, we then begin the workup for infertility. And about 2/3 of the time, the infertility can be related to female factor, and about 1/3 it actually can be male factor. Male factor includes a number of different aspects regarding sperm. So we look at sperm count, there's sperm motility, there's sperm morphology. There can be, other issues with the male partner being able to ejaculate and then to have intercourse. The female aspect, there's a lot of different topics. There can be structural issues, like the tubes are not open for that patient because there could be scarring in there. There could be a history of endometriosis that's complicating their fertility. There can be ovulatory issues so that they're not making eggs consistently. Sometimes even something as simple as not having appropriate thyroid hormone levels or a prolactin hormone level can also make it difficult to conceive. So if somebody is struggling, we do assess all of these aspects. And then, if something looks like we can easily try to manage it ourselves, we do. And if not, we quickly refer those patients to a reproductive endocrinology and infertility specialist. So if a patient has female factor infertility and she has a structurally normal, uterus and fallopian tubes, but hasn't been ovulating consistently, we can give patients ovulation induction agents to help trigger ovulation in those patients. And there's a handful of them that we do use. If somebody has a history of fibroids within the uterine cavity, sometimes those can make it difficult to, have a pregnancy through the first trimester. Then those patients also were able to remove those fibroids and help those patients conceive. Sometimes patients can have something called a hydrosalpinx, which is a fluid-filled tube, and they want to be able to conceive and get pregnant using fertility treatment. But to get to that fertility treatment step, the ideal is for us to remove that fluid-filled tube to improve their chances of having a successful fertility treatment. So this really is something that we work on with the reproductive endocrinology doctors. And if things get more complicated, we refer them out immediately to those specialists.